Great. So this group is very clearly aligned with the overall OHDSI mission of doing work that is going to help inform guidelines and produce evidence that's needed for guidelines, as well as some of the infrastructure that presupposes. And the overall mission is to develop and use informatics capacity to support evidence generation that will improve patients' mental health. And we did a lot in the last year, and it's people other than me, mostly I'm referring to here. And a lot of that is building on prior work that Dima and Paulina and others have done already to extend what you can represent in OMOP around patients' mental health. The information you get just from diagnosis codes is fairly gross and not very granular, not very well suited to the particular features of mental health that are of interest in most treatment decisions or predictions. And so one of the main underlying pieces of work we've been working on for years, building on that initial work, is making it possible to represent things in a standard way that gets at this more granular information, mostly by working on scales, psychiatric scales, neuropsychiatric scales, scale scores, even item level information. And we're doing that work in a way that's aligned with what other standard development organizations are doing. We're lucky enough to have Piper Rinaldo on, who leads the group in SNOMED that's helping to define what the overall structure for concepts ought to be and how they work, which obviously is a very important vocabulary for us. Also, there's work in LOINC and the human phenotype ontology that we're contributing to, and we're trying to get grants that help move all of that fairly complex but very fundamental work forward over the past year. We've also begun to assess support for the use of those vocabulary in representing data and neuropsychiatric scale scores. So we drafted and scoped the contents of mental health measures of interest so we can query interested members to see what they can get from various data sources in their EHRs, if they have EHR data, and identified viable strategies for collecting those data from EHR flow sheets, and as I'll mention in a second, from unstructured data. And so with respect to that, there's been a pretty large amount of progress, mostly driven by Ming at University of Texas, Houston, and building on prior work that Christoph and Jenna did for a study predicting conversion from major depressive disorder to bipolar disorder. And we're using that to see where you can get this other data you need to get the more granular information. So you can get it from flow sheets, which is just where your structured questionnaire data lives in your EHR, or getting it from text, notes, reports, and stuff. So there's been a lot of progress, a really excellent draft of a study protocol that's proving what you get, how you improve on that prior work that Christoph and Jenna did with this new information from structured flow sheets and unstructured data. And beyond that particular study, we're really trying to canvass who's got information of this type and specify in a sort of, I think, setting some of the stage for other research for who's got data on neuropsychiatric scale scores, what kinds of patients are they collected on, in what settings. I think a lot of the, once we get that descriptive understanding of what the community is able to do, we're going to be able to ask more and more important questions that are going to help define care. So we're moving to the place where a lot of this prior work is going to pay off. And for the next year, we're going to be building on that by completing that study on the value of NLP and flowsheet data, advancing the work on SNOMED, doing this work of characterizing, who's getting what kind of scale data from where, and demo that. We're going to be supporting other community members that are doing similar kinds of work on vocabulary and need this. The fantastic group in across several African countries, the Inspire Network is one of those folks we're going to be hoping to help out as they lead a lot of excellent work. And then Tatiana is, as you know, hopefully proposed this work for Phenotype February that's really helped setting the stage for informing guidelines about treatment of psychosis data. Please do join us. We meet once a month on Wednesdays from 8 a.m. to 9 a.m. Eastern, and you can sign up in the usual spot. Thanks so much.